This is a Blend Extra. In an effort to alleviate the pressure on overstretched hospitals and to protect healthcare professionals, the world's first two-stage coronavirus test is about to become available to frontline workers. Joining us is Dr. Robert Mordkin. He is the Chief Medical Officer at Let's Get Checked. Welcome, Doctor.
Thank you. Appreciate the opportunity.
Absolutely. Let's talk about the process that it took to actually develop these screening kits.
Yeah, it was a monumental effort. We're a company that started in 2015 with the premise that being able to do home lab testing had real value and benefit from a safety perspective, convenience perspective, anonymity perspective. And so we've been doing that for a number of years and have built the infrastructure and platform to do it and do it well. So when COVID pandemic came along, we felt perfectly positioned to be able to pivot to COVID testing quickly and be able to provide tests to those who need it most.
I think a lot of people have heard in the news about other screening kits in the market. What makes yours unique?
So our kit, testing kit, actually contains within it two separate testing components. The first component is what's deemed a rapid test, and this is a test strip, almost like people might be familiar with a pregnancy test strip. But in this instance, a person would self-administer a finger prick or a finger stick to get a drop of blood, put the drop of blood on the strip, and within 15 to 20 minutes, we'll get a visible positive or negative result. That test is looking for the presence or absence of antibodies, which are things that our body's immune system will produce when they've been exposed, or when the body's been exposed to certain infections such as viruses. The second component of our kit is a testing component that I think people that have been following the media are perhaps a little more familiar with, and this is the swab collection component. So an oral and nasal pharyngeal swab, which then gets packaged up in our kit and overnighted to our own lab, where once it hits our lab, we will be able to turn around a result in 48 hours or less. And what that component is testing for is something called a PCR test that looks for the presence or absence of the actual coronavirus. So we've got two components within our test kit.
So the antibodies and the current virus in your body, how easy is it going to be? Everybody's going to want to say, I want to get screened. I want to do this.
Of course. Yeah. Currently, our kits are being distributed through channels that we have already previously have established so that they go to those that we feel need it most, to healthcare workers, frontline workers, people along supply chain, things like that. They are required currently under the FDA to be administered under the supervision of a healthcare provider. But the goal here is we've submitted to the FDA request for people to be able to self-administer. We believe the efficacy is the same. And so once we have that, then we'll be able to hopefully release it to the general public.
We're out of time, but how much are they real quickly?
$129, which is our cost to produce and distribute it.
Doctor, thank you so much for joining us. We appreciate it.
Thank you.
The website to learn more is letsgetchecked.com.